So let's talk about compassion first. I think compassion is what's enabled us to cope during this period of enormous difficulty. The compassion that you and health and social care staff have shown for patients and service users across the country, the compassion that you've shown for each other, the cups of tea, the hugs, the checking in on each other, and the compassion that the community has shown for those around in the community, the care for elderly people living alone, the support for people with disabilities, it's compassion which has held us, and it's compassion which holds us in times of fear and anxiety and pain. And because compassion is about how we connect with each other, it's about creating a sense of belonging, and belonging is so important in human behavior. We're more likely, well, we're as likely to die from the effects of loneliness as we are from the effects of smoking or obesity, for example. So compassion is what enables us to cope. But what does it mean? I mean, in practice, for me to be compassionate to somebody who's in pain or distress, I have to do 4 things. I have to attend to them, I have to understand their challenges, I have to empathize with them, and I have to help them. So attending is about being present with the other person. Attending, giving my attention, being here and now with them. To use Nancy Kline's wonderfully evocative phrase, it's about listening with fascination. And second, it's about seeking to understand the challenges that they face, not through imposing my understanding, but through having a dialogue. So we're able to find a shared understanding about what that distress or pain is caused by. And then that provides the basis for the third element of compassion, which is empathizing. I have to feel the other's distress or pain without being overwhelmed by it, because that gives me the motivation for the fourth element of compassion, which is helping or serving the other person in their distress or in their pain. And what recent neuroscience studies have shown us is that there's a real difference between empathy alone or sympathy and compassion. When we ask people to be empathic, that's associated with the activation of pain centers in the brain, understandably, because we are feeling the other's pain or distress or fear. Whereas when we ask people to be compassionate, that's associated with the activation of reward centers in the brain. And that makes sense again, because we know that the vast majority of human beings are hardwired to be compassionate and altruistic. We've evolved to be helpful to each other. We find being kind, being helpful, being altruistic is rewarding. And we've also come to understand a lot more about the role of compassion in health and care. A review in 2019 by 2 American medics, Tresiak and Mazzarelli, reviewing hundreds of studies on the role of compassion in healthcare, has shown that it's probably the most important intervention there is in all of health and social care. So I'm just going to select some bullet points. They're not even highlights from this huge review that they've undertaken, mostly randomized controlled trials, a sort of gold standard of research methodology, or they are meta-analyses where the data from all the published studies on a particular topic are combined to give us an overall picture. The first is an example of a randomized controlled trial of anesthetists' pre-surgical visits to patients, where they either do a normal pre-surgical visit and provide sedatives, or they are asked to be just go and be extra compassionate without providing sedatives. And in the compassion intervention, what we see is that patients are calm but not drowsy, whereas in the normal intervention with sedatives, patients are drowsy but they don't feel calm inside. And what's I suppose, particularly pertinent is the finding that those who receive the compassion intervention have a much lower requirement for painkillers post-surgically and a significantly shorter length of hospital stay. The second example is a randomized control trial of patients with an early diagnosis of non-small cell lung cancer, metastatic lung cancer, which is very likely to be terminal. And it was a study of quality of life of patients, and they were either assigned to normal early cancer care treatment or to early palliative care, if you like, extra compassionate care. And indeed, what the researchers found was much better quality of life amongst those patients assigned to the early palliative care condition. But also what was a surprise was the finding that those patients lived significantly longer. And we see similar profound effects of clinician compassion, whether it's doctors, AHPs, nurses, in the treatment of long-term conditions like diabetes or HIV, and also really significant effects of compassion, clinician compassion, in the treatment of mental health problems for people. Now, the reaction of many clinicians when we talk about compassion is, and in fact the majority say it's great, but they don't have time to be compassionate. But what this review showed was that the evidence is that compassion doesn't necessarily affect encounter length. Indeed, in some of these interventions, which were sort of scripted interventions, if you like, scripts to be compassionate, the interventions took no more than an additional 20 seconds to 40 seconds. But also what's fascinating is how when, for example, in one study, GPs are asked to show extra compassion in their consultations over a 2-week period, that has a significant impact on their own mental health and well-being, with significant declines in anxiety, depression, stress. And that's been borne out in many studies, consistent with what I said about the neuroscience studies. So extraordinary findings across the board, which tell us about the importance of compassion in health and social care. And the effect sizes are truly remarkable, greater than the effects of aspirin in the treatment of heart attacks and the effects of statins in the 5-year risk of a cardiovascular event. So the challenge, if you like, for us as 21st century leaders is how can we create the conditions in our health and care organizations, in our communities indeed, and our community organizations, where people will be compassionate in their interactions with patients, service users, with each other, and with people who we work with across boundaries. And the answer to that question is, well, that's about the culture of the organization. And every interaction by every one of us every day in our work is an opportunity to shape the culture of our organizations. How warm we are, how kind we are, how irritable we are, how cynical we are, how compassionate we are. Every interaction we have shapes the culture of our organizations, because the ripples spread out from our behaviors. We are, after all, the social animal. But the role of leaders, and this is particularly why the 21st Century Leadership Program with its emphasis on compassion is so important, and why the value of compassion in central northwest London is so important. The role of leaders is particularly powerful. What leaders pay attention to, what they talk about, what they monitor, and particularly what they model in their own behaviors, tells us what it is that they value, and therefore what it is that the organization values. So leaders must embody compassion in their leadership. That means leaders paying attention to those they lead, being present with them, listening with fascination, and leaders seeking to understand the challenges that those they lead face, not by imposing some understanding from a distance, but through dialogue, arriving at a shared understanding of the challenges that those they lead face, and leaders who empathize with those they lead. I mean, given what I said about levels of stress among staff at the beginning, and in central northwest London, that's very high. It's around 45% of staff last year reported being unwell as a result of work stress. So it's vital that leaders are empathic in their responses with staff, because that gives them the motivation to take the fourth step of compassionate leadership, which is helping or serving those we lead, by helping to remove obstacles that get in the way of them doing their work effectively, and or ensuring they have the resources they need, the right numbers of staff with the right skills. And it's great to see a local workforce strategy being developed in central northwest London, making sure that they've got the equipment they need, the PPE equipment, making sure that they've got the technologies they need and computers that work and are accessible, and making sure that they have the training they need to do their jobs effectively. And this is not some fancy new model of leadership. We've known for the last 60 years that these four behaviors are critical to effective leadership in organizations. If you look in the private sector, we know that when leaders behave in this way, that has an impact on staff satisfaction, which impacts customer satisfaction, customer loyalty, productivity and profitability. And that value chain has been well demonstrated in research by colleagues in the United States over many years, people like Ben Schneider. And so these four behaviors, it's not a coincidence that these behaviors are the same behaviors that constitute compassion, because they're the behaviors that enable us to establish connection, to build trust, to build that sense of belonging. We know that probably the most important skill of a leader is listening. That's what all of the research over the last 60, 70, 80 years tells us. And probably the most important task of a leader is helping those we lead to do their jobs more effectively, as I say, by removing obstacles and or ensuring they have the resources they need. And we know, excuse me, that these leadership behaviors are critical to performance in NHS organizations. We've now had 18 years of the staff survey running, with over now 500,000 responses from staff every year. It's an enormous, unique data set in the world. And because we have all of that longitudinal data and so much data, we're able to do the most sophisticated statistical analysis. And what that tells us is there's no more important predictor of central northwest London's performance in two years' time than the staff survey data today. And that goes for every trust in the country, whether it's a mental health trust or an acute trust or an ambulance trust indeed. And if we look at the staff survey data over time, what it tells us is that what staff say about their leaders and those four behaviors predict patient service users' satisfaction with care quality. When staff report high work pressure, service users and patients subsequently say they're treated with less dignity, respect, compassion than they would wish for. In trusts where staff report high levels of work stress, poor health and well-being, subsequently we see in those trusts significantly worse care quality, significantly worse financial performance, lower levels of patient satisfaction, higher levels of staff quitting and absenteeism, and in the acute sector, significantly higher levels of patient mortality. So for all of these reasons, compassionate leadership must be central to the way that we restructure, where we recreate our NHS and social care organizations of the future after the pandemic. But it's also important to emphasize that compassionate leadership is not some soft cushions or scented candles approach to leadership. I think it requires a great deal more courage and authenticity and honesty than the rather easy opt-out of command and control leadership. Because compassionate leadership is focused ultimately on the communities that we serve, on patients, service users, communities. And so compassionate leadership is very much about having a strong focus on performance and clear, authentic, honest performance management, and compassionate approaches to performance management. And it's certainly not about taking some easy consensus way forward to leadership. Well, I'll just see what everyone else thinks in the team, and then we'll go with that. I think, for example, Nelson Mandela, probably one of the greatest, if not the greatest leader of the 20th century, when he was released from Robben Island prison after 27 years, and his millions of followers in the African National Congress were celebrating because they now had a leader who could take them to war and overthrow the apartheid regime. Nelson Mandela went against the millions of his followers, and despite the terrible atrocities being committed by the apartheid regime at the time, the murder of Steve Biko in prison, for example, Mandela insisted on, out of his greater compassion, I think, for his country as a whole, insisted on seeking, if possible, a negotiated way forward, and against all of the odds succeeded in achieving a relatively peaceful transition to a biracial South Africa. And that's, I think, what compassionate leadership is about. It's also about our collective leadership. It's about all of us modeling these behaviors in our leadership for the future, and about our institutions, our organizations behaving compassionately, so that Central Northwest London, working with the community organizations that it works with in Grenfell, in Brent, in Milton Keynes, adopting an institutional orientation of compassion, of listening, of seeking to understand the challenges that others face, of other organizations and community organizations, voluntary sector organizations face, of empathizing, and then of always asking the question, how can we help? So compassionate leadership is these four behaviors, but it's also leadership that must be effective. And that means, what we know about effective leadership is that it creates three things within our organizations, or our teams, within our teams. It creates direction, a clear, shared, inspiring purpose. It creates alignment. It ensures that there's alignment of efforts around that purpose, that teams, departments, directorates, organizations are working in an aligned way across boundaries. They're not they're cooperating, and they're not dissipating their efforts on unnecessary activities. And effective leadership creates commitment, a sense of trust and motivation amongst all of the team members, or amongst all of those who work in an organization. So